Thanks very much. Before I get started in earnest, one of the silver linings of the pandemic, if there was such a thing, was getting to work with Rob on our polling series on the impacts of COVID-19 on mental health and substance use health in Canada, and really to unpack that close interrelationship between mental health and substance use health, including cannabis use. And I'm not going to talk about it today, but those reports are all available on our websites, and there's lots of interesting findings as well. So I'm going to talk about the results, the key findings basically of 5 years of research. We had the sister $10 million investment in cannabis research that was announced along with the introduction of the Cannabis Act, but in this case to do a 5-year research program on the relationship between cannabis and mental health. And this is the 5 years in review. So I think I've done this virtually a couple of times, or my colleagues have. I haven't come to this conference, but it seemed like because we were at the point where we're actually mobilizing the findings from that five years, it would be great to come. So we were funded to do a variety of things. A lot of consultation, starting with an evidence review as well, to really tailor our research to where the gaps and needs were the most acute. And then based on that scoping work, we funded a suite of research projects, both academic and community-based research, as well as different types of knowledge mobilization activities. So how did we do? Well, we did also similar to CCSA. We were able to get the money out the door for 40 research projects across Canada. There was a lot of change that happened in that 5-year period with the pandemic in particular, but also with some of the delays in licenses for funded research projects. So while the Act had been introduced, I think the regulation and licensure didn't necessarily reform at quite the same speed. So we did end up with some shifting, but great to see we had 7 projects that were focused and led by First Nations, Inuit, and Métis. We had also quite a mix of quantitative and qualitative research, again being guided by the scoping review work that was done in the initial phase to see where the gaps were greatest. So what did we learn? So first off, we know that at the beginning, a lot of our research, the primary data collection was done in 2020, 2021. So, initially we didn't see that there was really much of a shift in concerns regarding psychosis. But, as we look to mobilize these findings, we're realizing that emerging data was coming, and we'll hear more about that from Dr. Mirren tomorrow. It does seem like there are some emerging evidence to suggest that those rates of substance-induced, cannabis-induced psychosis, as they are rising, that could have, that psychosis risk and rates of psychosis, while they haven't gone up at this point, it's a lagging indicator, and we may see that come with time, and really the importance of making sure that we redouble our public health messaging to ensure that youth have the best available information as they're making choices. Another thing we heard, and keep in mind here, a lot of this was based on qualitative research. Many people who participated in the studies that we funded really had mixed feelings about the benefits and harms, mixed perceptions of the benefits and harms of the relationship between cannabis and their mental health. So, one and the same participant often would be saying there are benefits to their cannabis use for mental health, and that there are also some risks. So, a really complicated relationship that, again, we're just at the beginning of understanding in a post-legalization environment. it's complicated relationship, and part of the ways it's complicated is the barriers in access, which are disproportionately distributed across different groups in our society, whether those are financial barriers or cultural barriers, linguistic barriers, etc. When people don't necessarily have access to mental health supports that they feel comfortable accessing or can access, cannabis is often an alternative for folks in that situation. You know, the relationship between cannabis and mental health is really mediated to a large extent by social determinants, and we saw that time and time again in our studies. You know, we were asked to do this, and we ended up very much running a research program that does this. And frankly, this is true for health outcomes of all types. But it was really important as we think about the relationship and over the course of the conference, as you explore the impacts of legalization on society and on health outcomes, to really keep this relationship in mind. So of course, we're just starting, as I said, to understand what these relationships look like post-legalization and in this post-public health emergency phase of the pandemic. Stigma is still a really big issue. So, you know, while people felt that stigma had reduced, you know, it was still a barrier for seeking information and support for many people who participated in our funded projects. You know, there are still significant issues. Well, criminalization rates have reduced, as we know, post-legalization. There are still ongoing ways in which the Cannabis Act, the criminalization components of it, are being disproportionately distributed across different groups, and the legacies of pre-legalization, criminalization continue to affect people's lives and their mental health. We also heard from many people, this one is controversial. I'm thinking of Senator Kuchar's remarks around evidence or knowledge, which is it? You know, many people in qualitative studies report using cannabis as an effective, from their perspective, harm reduction approach to reduce or eliminate the use of more harmful substances. So we hear this from people. It's part of people's lived experience of using cannabis as an alternative to opioids, for example. And, you know, this is one line of evidence. There may be other lines of evidence, and I think there are, that show that when we look at the actual outcome data, that a different picture emerges. So it's complex, and it's important to have different lines into this phenomena, because if we just look at the numerical data and we don't actually talk to people about their experience, then we're also missing part of what's important in terms of supporting the mental health and well-being of the population. We heard a lot about how it's really important for cannabis education to have a balanced approach that it is inclusive of harm reduction, as well as consideration of abstinence, and that be very much grounded in the communities that are the focus of the education. Youth in particular report that an abstinence-only approach is a big turnoff, I guess, essentially. It might work for a few people, this kind of fear-based abstinence, but that abstinence-only approaches really do not resonate with the youth who participated in our studies. So priorities for action, lots of research still needed. I mean, we are just in the early stage of understanding, and especially with that elevated rates of cannabis-induced psychosis, the importance of really monitoring how that's developing, and whether that we're seeing what we believe is a possible outcome, which is that could translate into increased rates of psychosis. It's really, really important. The need for longer-term research, and the importance, again, of grounding that research in lived and living experience. the importance of addressing barriers and access to mental health care so that people who are turning to cannabis because they aren't getting what they need in terms of mental health supports have more choices. The importance of focusing on protective factors at the community level, really to, again, think about cannabis, mental health, and social determinants and how those things interrelate. The importance of training for helpers that both equips them with the best available knowledge. It's based in harm reduction principles and combats stigma. You know, we heard from a lot of people that when they go for help, the people that they go to don't know what to tell them, or that they experience a stigmatizing response. So we really need to focus on equipping people who provide healthcare and other services to do better. Combating stigma and systemic discrimination so that we don't have this disproportionate distribution of the harms associated with ongoing criminalization and legacies of criminalization, for example. What's to come? So similar to CCSA, we have a whole lot of knowledge mobilization products. Their website looks a little fancier than ours, but we're doing essentially the same thing. We'll start with a first release on October 17th and then continue to release findings from the various research projects, different types of syntheses, and so on. So watch our website for this material, and we hope that you find it interesting and helpful. I think, again, this is just the tip of the iceberg, but we were so honored to have the opportunity to participate in this research space for the past 5 years. Thanks very much.